Relapsing remitting MS is a form of MS where a patient only has episodes of inflammation or relapses, and they don't have any signs of progression. What that means is they'll have a new symptom that comes on over days and weeks, and then usually leaves over days and weeks. And when they're not having a relapse, they're not getting any worse in terms of their symptoms. The first day, people don't usually know they're having a relapse because it could just be kind of an off day, a symptom that's going to go away. But if the symptom is more the next day, and then especially if it's more the next day, that's when I think people really know that they're in a relapse. So there are some very typical relapse symptoms of MS, and those would be, optic neuritis. So that would be a temporary visual blurring, dizziness, numbness, or weakness. And that's like a localized thing, like either it will be one half of the body or maybe both legs, but something that's localized on the body. It's not usually the entire body. And we don't really understand why a patient has the onset of a relapse, but for some reason the immune system turns on and the white blood cells go into the central nervous system and create a new lesion in the brain or spinal cord. So there's only two things that we know that can trigger an MS relapse. One thing is an infection. So if a person has an infection with relapsing remitting MS, most of the time they don't develop a relapse, but sometimes they can. We do know that what happens is the immune system gets activated to fight the infection and then the attack on the central nervous system. The second thing is that some women, after they have a child, they do have an increased risk of having a relapse. So not all relapses are treated. It depends on what the relapse is. So if a patient is tolerating the symptoms, we actually just, we have them come in, we examine them, and we monitor the symptoms. The reason we treat a relapse is if a person has trouble functioning. That would typically mean seeing, walking, or using their hands, or they're in pain, which is rare. And then we would use steroids. So because the thing is, steroids, they decrease the time a patient has a relapse. What's important to understand is that actually not treating an MS relapse is not dangerous in and of itself because the body heals the inflammation that was there, okay? With or without treatment, that will be healed. But the thing is, if a person is having like trouble seeing or trouble walking, they could get into a problem with that. Sometimes when patients do have a relapse and they're not kind of listening to their body and they continue to do things to maybe aggravate the symptom, that's not a great idea. So if somebody's having tingling in their feet, they might want to take the bus that day instead of walking all the way there, just to give their body a break until they can get better. A patient should always let us know when they think they're having a relapse. First of all, I just as a doctor, I always tell a patient, I'd like to worry about it with you. I don't want you to just be at home worrying about that symptom by yourself. But secondly, it is very important because we need to make sure we have you on the best treatment. Patients in the newer treatments that we have out can expect a relapse very infrequently. On average in our trials, it's like 1 in every 8 years. And so because of that, it is a sign that maybe we need to have a patient on a different treatment if they're having relapse on the treatment they're on.